So we are going to talk about CDS triggers and how to create them. So from your main EMR screen, you would go to the templates icon and you would choose the CDS tab. And here you'll see a lot of CDS triggers that I've already created. So to create a new one, there's the familiar plus new. And you would put your title, whatever you're wanting to call it, in there. And this right here, this CDS match message, is what you want the computer to display if a patient matches the criteria. So just for a very simple one, you could do something like you wanted, okay, we'll just leave this called the same. If you wanted this to show all of the male patients or something like that, you would say this patient is male. Obviously that's not a useful one, but just for showing sake. So this patient is male is what the message would display if the criteria is met. And then there's also a CDS no match message. Now I find personally that I don't put anything in this. I just find that the absence of the match message is what I like, because then it doesn't clutter up your screen with triggers that are not the case. So usually I end up leaving the no match message blank. So we will close that one. We'll go into detail in another section about how to add criteria. So now I will show a little bit more about the different types of triggers. So we have appointments. Now this is at the very top here. You can see trigger. Now this means what kind of event do you want to happen to trigger the CDS alert happening. So if you choose appointments, then this shows in the demographic preview at the top of the screen, or sorry, on the left of the demographic tab. I'll show you when you're creating a new appointment, and also in the schedule. And I'll show you each one of these just in another section on workflow. So you can also choose, the ones that I use the most are the appointments, the demographics, demographics shows in the demographic preview and the demographic tab. And then for visit, it shows in the demographic preview and also in the visit. So as I said, in the workflow section, we'll show how those work for you when you're using them in practice. So once you've created your CDS trigger, the other great thing that you can do is you can change who the trigger will show for. You know, sometimes it's something that you only want the receptionist to see, or you only want the physicians to see, or maybe even a certain physician. So once you've created something, you go onto this side here, and if it doesn't have an X beside it, if you hover over that, you can see that it says enable CDS warning for user. If you create it, you automatically activate it for yourself. But if you right click, so I've just right clicked, you can see that you enable the CDS warning for a group. So as long as you have your group set up properly, you know, all of the physicians, or if there were a certain physician user group, you could enable it for that. If there was just one person, you had them set up as a group, you could have just one physician, have it set up for them. So those are the ways that you can control who sees the triggers in order to be in order to be appropriate. All right, so in the first section, we talked about the different kinds of triggers: appointments, demographics, and visit. So I will show you in this section how I'll show now how the workflow works for if a medical office assistant or whoever it is rooming patients. So once a patient is on the schedule here, you can see that there is the familiar icon of the CDS trigger right there. So if you hover over it, you can see from there that it also lists certain CDS triggers. And this could be helpful for, perhaps clinics that have it set up that they have a vitals room or something like that, so that the person doing the vitals while they're bringing the patients back doesn't have to open up their chart in order to see what it is that they're due for. So it offers a very quick access to things that they would need to do, and you can set that up so that only the appropriate ones show for this circumstance. So on their way to the exam room, the MOA would go in the vitals room and get the height and the weight and the blood pressure, and then be able to record it while in the visit. So once we go into the visit, we would create a new visit just like we always would. And you can see that here we are. Again, we have these same icons showing, and some of them have those task icons that we're talking about. So let's see, the MOA got the blood pressure, so let's put that in. Also got the weight because the BMI was needed. We already have the height in there. And we'll calculate. Oops, that's not a good BMI at all. I can't think in kilograms. Okay. And also I'll show you from here as well how you can launch a task. So for example, the patient due for PAP, you would click the task, and again it would bring up investigation, PAP, whatever form you have mapped here. And save that, and that will go off. So now again, you can see that these haven't cleared off yet. We still have the PAP showing, still have the BMI showing, still have the blood pressure showing. So what would need to happen in order for these to disappear is you would have to save the visit, and you would have to kind of clear the cache by, or kind of really close the patient by getting it to look at something else. Usually you can go back to the schedule, I believe, as well. So you can kind of decide with your clinic what workflow works, if it's worth it to go out and back into the patient chart, or if you just kind of leave it and they can see that those measurements have already been put in. But you can see now that those, the BMI prompt is gone, and the blood pressure prompt is gone, and also the PAP prompt is gone. So that is how they work in those several workflows. So again, we go from our main screen to the templates icon and the CDS trigger tab. Now you'll notice if you look at a patient's chart, you will not see this CDS triggers tab. It's only in the template section that you will see this CDS tab. So now I will show call this one test 2. I have one just like this already. So diabetes monitoring. So we're going to create a trigger for diabetes screening. So anyone over the 40 and over who has not had either a fasting glucose or a hemoglobin A1C in the past 3 years. So that is what we're going to be setting up here. And we decide that we want this trigger to happen in the visit, because then, of course, that would lead to wanting to order the lab work, so that would make sense for the physician to be involved in that. Now, also, what we can put in here, this task here is where you put in which icon you want to launch, which task you want to launch. So I have one made up here. There we go. So the more you make, the more is in that list. We just have a lot made. So there we go. So that will generate that task icon to launch that. And then we want the CDS match message. And we would want that to say, just keep this test 2. Do for diabetic screen. And if they don't match for it, we don't want it to say anything. If it doesn't say it, then yeah. All right. Now, it will automatically set this state criteria type to relative, and that's what we want. So relative means that it will keep the framework of the dates as you move day to day. So if I set criteria for a year today, then tomorrow it will be a year from tomorrow. So that's what that means, the relative date. So that's what it defaults to, so you don't need to change that. So now we put in our criteria. So I'd like to use ones that are active. And for that primary provider, or you can put a provider group down here if that's how your clinic is set up. If you have multi-physicians, that's likely how you'd want to do that. And then we want to put, in order to get the age range, we want to put date of birth. Now, the reason for choosing date of birth instead of age is because I found that if you do age, it doesn't change the year on their birthday. It changes the year at the end of the year. So to get a much more accurate count of when people have their birthdays and become eligible for things, it's best to put their birthday in there. So we're going to put in, so that we get everybody very old, include everybody, and then and then 1974 would make them 40. Make sure to have both of those boxes checked. Then we move down to profile. So if somebody is already diabetic, we don't want to do this screen. So we need to tell the criteria that. So in this profile section, we would click not. And then we need to tell it, so not diabetes. And it's preferable to specify in here medical. The reason for that is if somebody has put a family history of diabetes, you wouldn't want that patient being excluded from this if they have a family entry in there. So put medical, and status current as well. Whenever you create a new profile entry, it will automatically do it to current. So it's good to do that. It leaves room for if you ever need to set anything to past. And then we would put in our diagnosis. Okay, so this section basically says we don't want to catch people that already have diabetes. So we've done that. Now, we also want to find people who have not had certain lab work. So again, we will click the not, and we'll put category lab. Now, it would probably still find what you're looking for without having this lab clicked, but it reduces the strain on the system if it kind of narrows down where it is that it's searching for. So the test that we're wanting to look for is fasting glucose. Now, it's important that you know which one in your clinic is the correct one. That's kind of another webinar. So we want to be clicking the last because we want it to look at the most recent. And there we go. That's it. And you want it to be exact. We don't want it to pull other things that aren't exactly that. So that's all we need to put in there. And then to add in an or, so we want fasting glucose or hemoglobin A1C. Just put in A1C. Grab the wrong hemoglobin. The reason why we use this plus right here and not that plus, you add one of these, this makes the logic an and this one makes the logic an or. This means you can have this or this. If we add another section right here, that would mean that the person would have to have both not a fasting glucose and not a hemoglobin A1C. We know what the difference is between those. And now for the dates, we want it to be 3 years back. So we are going to make this 2011 and to today. And we would save that down there. So now we should be able to find this triggering. There it is. That's our trigger that we just made, test 2, due for diabetic screen. And we click on that icon, the one that we picked to be the task. And this is the lab requisition here. So that is how you can use CDS triggers in order to do just-in-time screening.